Good morning, everybody. Welcome to Anitian's Hacking HIPAA seminar. I'm Steve Swan.
Hello, this is Adam Gaidosh. Today we're going to be talking about hacking HIPAA.
All right, so we have a very exciting set of topics for you this morning. We're do a few introductions first, and then we're going to talk about the changing HIPAA landscape. Essentially, we've made a lot of observations in working with our clients about the current state of the industry in terms of both compliance and the current threat environment that everyone is facing, what kinds of concerns people have been airing with us. We're going to talk a little bit about HIPAA compliance, whether or not that's going to help you with your concerns, and then when we're done, we'll have a little bit of a Q&A at the end of it. So my name's Steve Swan. I'm a senior analyst here at Anitian. I'm a QSA, CISSP. I've been in the industry for closing in on 20 years now. I've sort of done it, soup to nuts. With me is also Adam Gaidosh. He's not listed on the slide here because I wasn't expecting him to be in the office this morning, but he's agreed to join us as well. He's the Director of Client Services here at Anitian, the Director of the Engineering Department. He's also a senior security person with close on 2 decades of experience, so we're going to share our experience with you. Do you want to talk a little bit about the Anitian program?
So, the mission statement here at Anitian is really to build great security leaders. This is what we want to do. This is what we want to enable our clients to become as great security leaders. And the reason is that we really do think security can make the world a better place. The freedoms that we take for granted can be supported by a secure society, and of course that's directly supported by the information technology that we all use in our everyday lives. And so that's really what our mission statement is here at Anitian, to support innovation and growth, to do so to secure environments in a practical and pragmatic manner is really the linchpin of our philosophy when it comes to security. So that's how we try to align our practice in all of the services that we provide.
All right, thank you, Adam. Pragmatic security, that's something that you'll be hearing more as we progress with this, because obviously with a title like Hacking HIPAA, obviously we're going to be talking about some things that might sound scary, but we are not into fear, uncertainty, and doubt here. We're gonna talk about the pragmatics of it and what you should and shouldn't concern yourself with. So first, we're going to talk a little bit about the current threat landscape. So the truth of the matter is that for a long time, HIPAA was one of those regulatory standards that sort of sat on the shelf. A lot of people didn't concern themselves with it too much. Even covered entities were sort of the understanding that, it was unlikely that they were going to be audited. It was unlikely that they were going to be attacked, because who had a use for healthcare data? Obviously, there's much more exciting stuff to hack. So that has been changing, and there's a reason for it. It turns out that healthcare data is actually valuable. What's been happening over the course of the last several years is that we are seeing that people are making active attempts to steal healthcare data because it is worth money. You can use it for insurance fraud. It's a multi-million, probably multi-billion-dollar industry for that. And also it turns out that healthcare data makes a wonderful basis for further identity theft. Stolen healthcare records worth more than stolen credit card data. Credit card data goes for $1 or $2 a piece. You get somebody's full health record that sells anywhere from $10 to $50 depending on how complete it is. So if you can steal a large number of health records, there's definitely a market for it. And who's doing this? So there's big money in it, which means that what has happened is that organized crime has moved in. We believe that there are also state-sponsored actors doing this. So, you know, not to get ourselves in any hot water here, but I think we all know who the state-sponsored actors are for hacking. And when we talk about organized crime, I mean, the Russian mob, they are well set up for this kind of thing. There are data centers in the Baltic that are almost entirely devoted to the subject of hacking. They do extensive vulnerability research, and anything that they can't develop themselves in-house, they can purchase on the black market. You've probably heard about the dark net. You've probably heard about the illegal marketplaces there, where you can purchase everything from drugs to stolen credit cards to healthcare data to vulnerabilities. So, you know, it's become a it's become a thriving black market, and they are purchasing vulnerabilities, and they are using those vulnerabilities as a way of breaching large organizations. So,
you know, and these organizations are incredibly mature. This is very sophisticated, the way they conduct their hacking activities, with different divisions, you know, really run like a business. You have dedicated people to developing the exploits, people deploying them. There are various actors responsible for monetizing whatever has been stolen. There are you know, fake businesses. They'll interview people that would be potential mules to do money transfers. So this is not, as we say, just, you know, drive-by hacking, random crime of opportunity, particularly with the Russian business network, which is the major player in the global hacking scene, if you will.
So there's a term that has, you know, been used a lot in the industry in recent years, advanced persistent threats. And what that is referring to is just what we've been talking about here. These are sophisticated hackers. These are not like individuals. This is not just a smart guy, you know, sitting in his room attempting to hack into. This is not war games.
Yeah, the classic,
you know,
laid-off nuclear scientist that's gone rogue.
Yeah, or some Scandinavian hacker, you know, sitting in his room listening to listening to heavy metal music and trying to break into your computer system. This is this is sponsored stuff. This is done by people with deep pockets, a lot of resources available to them. They spend a lot of money on this to keep their capabilities top notch. Once again, back to the part about they can purchase vulnerabilities, they can develop them themselves. They are willing to buy information from those random hackers that we talked about. If they discover a vulnerability these days, they're probably not even going to attempt to use it themselves. They will go and sell it for a lot of money.
We, in fact, have people solicit us on a regular basis trying to sell us zero-day vulnerabilities that they've discovered. So it's a very active marketplace, and it provides many opportunities for these criminal organizations to weaponize these vulnerabilities to exploit your data.
And I'm sorry to tell you that we're not going to outbid the Russian mob to buy those vulnerabilities. So, all right. What happens to people who get breached? It's expensive. Basically, Health and Human Services has started taking all of this stuff much more seriously. They're being more proactive about it. They are now actively looking at people's compliance with HIPAA to determine, whether or not they are likely to be subject to a breach. And if you have been breached, you'll certainly get audited at that point. As you can see, breaches have been expensive for people. We're talking millions of dollars for the larger organizations, but just because you're a smaller organization doesn't mean that there's no risk to you. 441 records breached, a $50,000 fine, so, and that doesn't even count the fact that once you've been breached and you make the front page of the New York Times, that's going to also play badly with your business partners and such.
And these are just a few examples. The Department of Health and Human Services, which is the agency that enforces HIPAA, has a wall of shame on their website that they publish all breaches of protected healthcare information. So you can go there and see all of the various organizations that have had disclosed breaches. And the increase in the focus on compromising healthcare data is one of the reasons why there is more focus on HIPAA compliance by Health and Human Services. Also, of course, the omnibus rule that was rolled up the previous HIPAA standards has also given them more teeth in regards to enforcement. So the trend that we expect is going to continue regarding the monetary fines for HIPAA noncompliance and, of course, breaches.
Yeah, and we'll be talking more about the omnibus rule and the changes in the regulatory environment shortly. So. So anyway, what are they? What are these state and criminal actors looking to do? Well, they've got a variety of means with which they can attack you. I'm sure you've all been subjected to phishing campaigns. Spear phishing is simply a more targeted version of phishing. That's where instead of just spamming out malware-infected emails, hoping that you can trick people into either clicking on an infected attachment or possibly going to a compromised web link. In spear phishing, they do some research on your organization and find out more about your internals, maybe get the names of personnel and send the emails directly to them so that people are more inclined to fall for it if it's something that seems like it was mailed directly to you. So,
and we're also even seeing where we cite targeting specific persons at the company. You may have heard the term whaling, which is a very targeted spear phishing, targeted the most potentially valuable employees at a company by value in regards to the access to data they may provide an attacker. So again, it just underscores the level of sophistication that we're seeing in these threats.
Yeah, these guys are on LinkedIn. They know about your company structure. So anyway, and then of course there's the plain old external attacks. So the fact is that you've probably got reasonable perimeter defense. I mean, in this day in the industry, most people do have reasonable perimeter defense. But the fact is that even if you've got a reasonably good perimeter defense, they can purchase vulnerabilities against some of your external systems. If they want to break through one of your external defenses, they can go on the dark web and just try to find a vulnerability that will allow them to exploit it, that would give them a beachhead into your environment. So, all right. I'm going to move this along a little bit. So anyway, just to summarize all of this, the threat out there right now is sophisticated attackers using sophisticated methodologies. They've got resources, they gather information, they're patient, they are able to execute. So this is a newer and more dangerous environment that we're operating in. It's we sometimes talk about the constantly evolving threat environment. And that's the truth. It is constantly evolving. The trouble is the bad guys are getting more dangerous. It's an arms race.
And as they continue to find ways to monetize this data, they continue to gain sophistication in their ability to exfiltrate it.
Yep. So, so what does all this come down to from your perspective? So basically, the only real way to combat all of this is with a risk-centric security program, which is to say, focusing on the actual risks that you face as opposed to, just using some kind of, delineated model of security. Defense in depth, if one thing doesn't stop them, hopefully the next thing will. Realistic policies and procedures, training and awareness is amazingly important, and operational information security, staying on top of things. We're going to circle back to all of this. This is more like a preview of what we're going to be talking about later in the presentation.
But I just want to point out, we emphasize operational security because so often we see organizations that have put great effort to mature their security program, and they're focusing on procuring and implementing the technical controls, developing complex policy and procedure frameworks, security work training and awareness, but then they fall down with the operational information security, the day-to-day, fingers on keyboard, monitoring, reviewing the alerts, responding, and you can have the most robust framework in place in the world, but if you're not keeping up with it and on a day-to-day basis, you're going to miss the signs that could be indicative of a compromise.
All right, so let's talk a little bit about where the regulatory landscape is these days. So obviously, the biggest change to the HIPAA regulatory landscape in recent years is the Omnibus Act of 2013. And that made a lot of changes. A lot of them were minor tweaks. A lot of them were confirmations of things that had previously been interim rules, things like that. But what about the bottom line here? So really, the biggest thing, and by the way, a little bit of this is targeted at people who are not necessarily covered entities, because a lot of our clients are people who work with covered entities. And a lot of the biggest questions that we get concerning this is, how is all of this going to affect me? So
I'm not an insurance company. Why do I care? These types of questions.
So really, one of the biggest ones is that business associates and even subcontractors, a subcontractor might not even be aware that they're working with protected healthcare information. That's the scary thing for a lot of people is, how would I even know that I'm dealing with protected healthcare information? You can be subject to an audit without possibly even knowing that you were handling that kind of data. That's a very scary thing for a lot of people. The Health and Human Services has moved more towards proactive auditing. They're no longer only looking at people who've had a breach, and that includes proactive auditing of business associates and subcontractors. The fines have gotten stiffer, and importantly here, the fines are much stiffer in cases where they feel that there's been negligence. So the fines are scaled towards how badly they feel that you were asleep at the wheel. So, and then finally, the need to do breach notification no longer is based on potential harm. These days, if you have been breached, you have to notify, and especially for companies that have clients in many states or even many countries, so that means a lot of notification in a lot of different areas, a lot of bad publicity. So who needs to comply with all these changes? So for covered entities, not an awful lot is different. I mean, like I said, some of the rules are a little bit stricter, and some of the urgency has been stepped up. I mean, there's more of a feeling that people need to be proactive about it. There's less of a feeling that you can kind of let HIPAA slide a little bit, as there has been historically. But for covered entities, it's not so very different. For business partners and subcontractors, it is now a whole new world. I mean, you are no longer just responsible to your covered entity. You are responsible to HHS, and you have to take compliance in your own hands.
And so if you have somebody that you work with that has requested that you sign one of these business associate agreements, then that means you have healthcare data. This covered entity is aware of that and is asking you to attest to your responsibilities to be compliant and maintain the security of their data. And that's really been one of the driving forces for the expanded awareness of HIPAA noncompliance.
So basically what this has meant is that a lot of companies have been blindsided. Our phone has been ringing a lot lately. We have a lot of clients who, in one way or another, deal with covered entities, and all of a sudden they have to ask themselves, wait, are we dealing with protected healthcare information? In some cases, like I said, there's been historically been a little bit of slackness around HIPAA, and as a result, not everyone who has been dealing with protected healthcare information has been signing these business associate agreements. And so in some cases, people have been just not even knowing whether or not that they've been dealing with protected healthcare information. So that's a bit of a rude shock to people, especially if you're a subcontractor. You know, maybe you're not even the person, maybe you're not even the company that has a contract directly with a covered entity. You might be just somebody who does, say, the networks, or, you know, maintains systems in a hosting center, something like that. You're responsible.
It's transitive, and that's one of the changes with the omnibus, explicitly preventing the loophole where previously business associates could outsource their handling of PHI to a subcontractor to alleviate their responsibility to be compliant, and it now does transfer to those subcontractors.
Yep. So basically, it goes all the stack goes all the way down. The compliance carries through. So, or the need for compliance carries through. You know, some like I said, some covered entities haven't always been good about letting people know. So, all right. So really, what we've been seeing is a lot of people are worried about this. The covered entities themselves have been reviewing their business associate agreements and looking at their partners and asking their partners, because previously they hadn't had to worry very much. You know, people have been subcontracting this, but now you've got to make sure it sort of carries in both directions. You know, you can say that the business associate and the subcontractor is responsible for it, and that's great. They're responsible for compliance, but the truth is that if they're not compliant and there's a breach, it's still the covered entity that's going to end up taking the publicity hit for it. You know, and then you can get into business of, you know, suing the subcontractor or whatever. But truth is, what we all really want here is for the breach to just not happen in the first place.
You know, and the pendulum's really starting to swing. You know, historically, the large covered entities were, you know, somewhat cavalier about HIPAA by virtue of the fact that the security and the privacy rules, these were interim rules. There was not a lot of enforcement action by HHS, and of course, the threat landscape towards monetizing this data was not as sophisticated. They've now realized that none of that is still the case, and so they are, in some cases, really demanding, as we emphasize here, full compliance, regardless of exactly what data one of their business partners or subcontractors may have access to. They're erring on the side of caution by requiring a demonstration of HIPAA compliance in these environments, which has become a challenge, an opportunity to differentiate oneself from a business competitiveness perspective.
So from the point of view of the covered entity trying to write up a business associate contract and trying to decide whether they can deal with a particular contractor or whatever, you know, are you HIPAA compliant? So they have a requirement to write up a business associate agreement that binds you to your responsibilities, you know, to maintain proper control of HIPAA data. So what are they going to be looking for in a client? And really what they want is someone who can just assert to them, yes, we are fully HIPAA compliant. That's the easiest thing for them, is if they can just look at somebody and say, yes, this contractor, you know, this associate is fully HIPAA compliant. Therefore, we can just, you know, put like a few, you know, standard contractual lines in our business contract with you, you know, bind you to your responsibilities and not have to worry about overseeing every aspect of your business. So being able to assert that you are fully HIPAA compliant is a business enabler for a lot of our clients. We've been getting people who are asking us to do a HIPAA audit of them, and the reason that they want to be HIPAA audited is basically so that they can assert to their business partners, yes, we are not only HIPAA compliant, but we have been audited thoroughly. So it's just a way of, you know, it's a way of attracting more business from covered entities and such.
And demonstrating due diligence, which, as we talked about, is a good way to mitigate the potential liability in the event of a breach.
So with all that in mind, let's talk about the privacy and security of HIPAA data. So the privacy rule. I wanted to talk about this one just briefly. The privacy rule doesn't get talked about a lot, but you know, business associates and subcontractors are exempt from the privacy rule. You know, I'm not going to dwell on that subject, but the fact is that being exempt from the privacy rule doesn't really mean a lot. You know, that it certainly doesn't it doesn't mean that anybody can go around handing out HIPAA data. Please don't anyone do that. You know, basically, covered entities are expected to put in their contracts appropriate controls and appropriate usage, so that it's sort of, they are expected to define what you are and are not supposed to do with HIPAA data. So you're exempt from the privacy rule, but you know, you're still answerable. So don't anyone be thinking that that just means that no one cares what you do with HIPAA data.
Yeah,
so.
I mean, this is a prime example of the covered entities that are aware of the risk that they have with trusting business associates and subcontractors to handle their data are still requiring demonstration of compliance with the privacy rule, regardless of exactly what standards has.
Exactly. So yeah, they don't really, the covered entities don't care that, you know, you're not obligated by the privacy rule. They want to see that you're behaving properly. So just wanted to mention that one up front. So HIPAA compliance. So what does it mean, basically? Really, there's a lot in HIPAA. HIPAA is a, you know, is a extensive, you know, legislative body of regulatory stuff. There's a lot there, and most of it doesn't really have anything to do with security. A lot of it is just paperwork, and that is for the covered entities. So when the covered entities come to you and say, "Are you HIPAA compliant?" you know, what they really mean is, "Are you following the security rule?" So that's the thing that really, when it comes right down to it, when they say, have you been audited, you know, and are you HIPAA compliant, what they really mean is, are you following the security rule?
You could generalize it and think of the two primary rules as, you know, the security rule and the privacy rule, with the security rule being the technical component and the privacy rule being the more administrative.
Exactly. So, all right, so let's talk a little bit about the security rule. So what is the purpose of the security rule? Really, it's about establishing the what we call the CIA model, the confidentiality, integrity, and availability of protected healthcare information. So there's a lot of subsections under the privacy rule, or sorry, under the security rule, and you know, it has the administrative, physical, technical, organizational, and documentation portions of it. But one thing that you'll hear a lot is people say that the security rule is not all that secure. And that's true. The security rule does not cite a number of industry standard protections. There are, for example, if you were to look at the SANS top 20 security controls, the SANS top 20 security controls is a good thumbnail list of the widely accepted proper security controls that an organization.
Specific technical controls.
Exactly, specific technical controls. The security rule does not address all that. There's a good reason for it too. I mean, it's a legislative thing. I mean, it takes them 10 years to pass anything. As anybody who's been waiting on the omnibus rule knows, they have to debate it forever. The lawyers have to go over and over it. You can't put too much stuff about specific technical controls into that kind of, you know, regulatory work. It's liable to be outdated by the time they publish it. So the fact is that the security rule doesn't cite everything. So,
which is why, you know, people find that it's not secure. It's not that it's really insecure. It's just that it's really more of a high-level standard.
So really, that brings us to the question of if that's the case, is compliance good enough? We've talked about the threat environment, and we've talked about the regulatory environment, and now I've said that the security rule isn't all that secure. So is compliance good enough? Well, yes. And this is a known contrarian answer. It is widely accepted that regulatory compliance is not good enough or secure enough. But here's the thing. I'm going to tell you why it is that the current HIPAA security rule is good enough. Obviously, the regulations themselves are, inflexible, infrequently changed, a bad place to be mandating any kind of specific technologies, especially when technology changes as rapidly as it does, all that kind of thing. What regulations do is they give you a good place to drive your security program, which brings us to the important part. The security rule has one piece of it that all by itself makes all the difference. Section 164.308, do a risk assessment and then mitigate your risks. That's a paraphrase, but basically that's what it says. It's about a risk assessment and a risk management program. The truth is that this is the thing that takes the security rule from being inadequate to being good enough. But you have to do it right. So you've got compliance on one side. Compliance is all about enacting certain basic sets of controls. It's mostly process-oriented stuff. Risk assessment and risk management is how you will extend your compliance to actually, encompass current threats, current real technologies. This is where you find out what state your environment is really in. You have to do an analysis of the threats and an analysis of where you currently stand with your environment and do a realistic evaluation of this. So really, this is how you will take the compliance and make it work for you.
Because they're not a list of specific prescriptive technical controls. The risk assessment is what gives you the opportunity to truly validate the effectiveness of the control framework that you've implemented to comply with HIPAA. And if you do this legitimately, and you have organizational buy-in, and you perform a thorough risk assessment, then it is absolutely possible to effectively mitigate risk using the security rule as your baseline. In spite of the fact that, yes, it is high level, because the onus is on you to implement the appropriate controls and then validate the effectiveness of them through the risk assessment.
Right. So there's two ways that you can approach a risk assessment. It can be either a checkbox item, because since it's part of a compliance standard, a lot of people expect it to be a little bit stodgy, a little bit frameworky, a little bit the
infamous surveys.
Yeah, surveys, checkboxes, just get it done. So if you take the just get it done approach to risk assessment, it will not add a lot of value. The truth is that you can always just do a risk assessment for the sake of checking off that box, calling yourself compliant, and that will not really address the problem. So when I say that, yes, compliance is good enough, I mean only if you sort of take it to heart, right? The place where you take it to heart is in the risk assessment, because this is where you take a real clear look at your environment. So here I talk about what exactly you should be doing, right? To do a risk assessment properly, you're going to identify all the potential threats to your PHI. And we talked a little bit at the beginning of this presentation about the kinds of threats that we're seeing in the environment lately. And then what you do is you go through your environment in a detailed and technical manner, and you line item all of the vulnerabilities that could possibly allow those threats to be realized. You assess all your current controls, and then that will enable you to determine what is the likelihood of any of these threats occurring. Have you got adequate controls in place to address them? This is a technical risk assessment. This requires people with a good knowledge of information security and technology and practice. And if you do it properly, the end result of this will be that you will draw up a list of the current threats to your environment and a list of ways that you can address them. And then this needs to become a risk management program. There's some guidance on the HHS site that talks about how this needs to be at least a yearly activity where you will go back and reassess things, find out how well you've addressed previously identified risks, and then look at the changing nature of the environment. So you need to look at what has changed in the risk environment. Obviously, it's something that's been evolving pretty rapidly lately because of the fact that there's so much money in it. They've figured out how to monetize this kind of data. So, the risk environment has been rapidly evolving. The technology environment has been rapidly evolving. And so this is really something where, you need to look at this, on a yearly basis to see what has changed, and you need to address it. So basically, I took a bit of a bold approach to this. The standard industry line is that you cannot, secure your environment with compliance, and that has historically been true. The fact is that a lot of both government and industry regulations have in recent years been moving towards a risk-based model, and the reason for that is the fact that risk allows these sort of things to be a one-size-fits-all approach, because you can address the risks that are specific to your environment. Different size companies have different risk models. Different companies that handle data in different ways have different risk models. And so taking a risk-based approach to it allows you the flexibility to secure your environment in a way that best fits your business model, your technology, etc. So now on this slide here, I've got some things about the way I feel is the appropriate way to address a risk assessment, but essentially it requires that you take a serious-minded approach to it, that you make it a technical assessment that looks at all of the technology controls in your environment. It looks at the way that you're handling data, both at the business level and at the technical level. It needs to be transparent. It needs to have executive support. It needs to have everyone involved who is going to be handling your protected healthcare information. And the end result of it is that you will find out how best to secure your environment.
So, the risk-based approach is what makes the standard, provides the opportunity to really reduce the risk of the organization and not just become compliant and demonstrate that. However, it also provides the opportunity for organizations to demonstrate compliance without actually having legitimately met the intent of the standard. So it is a bit of a double-edged sword to take a risk-based approach to a compliance standard of any type, but the fact is the industry is moving in that direction. We're seeing this across the board with many different regulatory standards, HIPAA being one of them. In fact, I was at the recent PCI community meeting, and there are some murmurs there, in fact, that the PCI data security standard, which is notoriously prescriptive with explicit technical requirements that some people find to be too heavy-handed. The expression, the PCI is not a salad bar, you need to do all of it, period. That may be changing as well because they're recognizing that there is a lot of potential value for implementing a risk-based approach to compliance. Yes, it gives you the opportunity to shoot yourself in the foot, to take shortcuts. If you're not honest with yourself when you're evaluating the effectiveness of your controls, then your risk assessment is nothing but a paperwork exercise that gives you a false sense of security. But at the end of the day, it's all about liability. So if you don't take it to heart and you implement a kind of hand-wavy risk assessment, and as a result your controls are ineffective and that results in a breach of your data, then it gets back to the whole fact of, did you perform appropriate due diligence? So so there is that coverage on the back end.
Yep. So the bottom line is that what we're advocating here is that you take that line from the compliance standard, you take it to heart, you do a serious and detailed risk evaluation, and then when you've got your results, that you address it. Make it a program. Address the risks that you find. It's probably, these things often end up involving having to, buy gear, hire people, make improvements in your environment. But that is how you address this. And then, like I said, the HHS says do it at least yearly. Do it anytime there's a significant change in either the threat model or in your risk posture. So when you change your internal technologies, if you do any major revamps internally, anything like that, and especially if you have any kind of a security incident. If you have any kind of a security incident, revisit that and see what went wrong. Reevaluate your risks.
And isn't that one of the new components of the omnibus rule, in fact, requiring risk assessments explicitly after a breach?
Well, that's related to what was breached. You have to do a risk assessment to determine what was the likelihood of the data having been exposed. And so, yeah, they're using risk assessment for everything these days. So,
okay.
Which brings us to viewer questions. Adam, if you would, please.
So, we have some questions here concerning the challenges that smaller organizations face with keeping up with the various regulatory standards that they're required to comply with. And we certainly sympathize with this challenge, that smaller companies are going to be, by definition, resource constrained in regards to their security program. I think probably the best approach, again, obviously we are large advocates of the risk-based approach to information security, but by doing so, designing an information security program that is risk-based will give you a framework that should be extensible enough to demonstrate compliance with any particular standard with which you must comply. So rather than necessarily taking a list of each standard that you must or potentially will have to comply with and implement all of the controls specifically aligned with those, if you start by taking a risk-based approach to managing your security program, you should have a robust framework in place that then the burden of aligning it specifically with any given standard should be significantly lessened. But at the end of the day, there's going to be challenges. So the smaller the organization, the more you're probably going to have to likely leverage third parties to assist you with this. This could be outsourcing components of your security program, various managed security providers, of course. We see a lot of people even migrating much of their IT infrastructure, period. The explosion of the cloud service providers, software as a service. By doing this, it distributes the responsibility and then the burden and lessens it for the specific small business.
And I'm going to insert a question here that didn't come through the web. This was asked to me directly by one of our clients, but he said, so what do I need to do in order to be able to assert to to our clients and people who want to do business with us, that we are HIPAA compliant? And I partly addressed that in the slide deck here, which is to say that when they say, "Are you fully HIPAA compliant?" 90% of the time, what they're asking is, "Have you fully complied with the security rule?" And I'm just going to point out that regardless of what security technologies you have in place, and regardless of whether you have a secure environment or not, you can't actually assert compliance unless you have done a risk assessment. So that's a key one that a lot of people sort of overlook. They have a lot of technology deployed and they have what they think is a secure environment. But if you haven't done a risk assessment, you can't be HIPAA compliant. So,
but by having done so and being able to provide the documentation, on demand as requested to a potential business partner that is requesting demonstration of compliance, because again, we're trying to underscore that we're really seeing a shift with the covered entities being much less concerned with having their business associates pass the checkbox audit and actually having demonstrated that they are taking the appropriate steps to mitigate the likelihood of a breach. So being able to demonstrate that analysis to potential covered entities is a really important part of the process. And of course, having a third party perform that on your behalf certainly provides additional credibility to the entire process, but it's certainly not necessary. But the real focus is that you do have documentation. So one of the questions here is concerning the awareness that companies have concerning the impact of a breach. Steve, you conduct a lot of risk assessments in the HIPAA world and elsewhere. Can you talk to me a little bit about what the what you see concerning when you're performing your facilitated discussions with folks concerning the likely impact of a breach of protected healthcare information? Is there a general awareness of what the current threat landscape looks like?
So to tell you the truth, when we're talking about the impact of a breach, that varies so wildly, dependent on the nature of the business that people are engaged in, like how customer focused is their business and how wide is their customer base and such. I mean, we've had people who have been very regional, so their business is very regionally focused, and like they had a breach and they were required to notify very extensively, like within the region in which they were doing business. And yeah, that actually had kind of a terrible impact on their business because they were in the newspapers and the television for quite a long period of time because of it. And nobody wants to be that local business that everybody's talking about for that reason. So yeah, it's gotten worse because of this. Because these days, you no longer have the judgment of harm. So like it used to be that if you could estimate that no actual harm had been done, like we lost the data, but there's no evidence that there was any harm from it. Like maybe we just lost the data, maybe it fell in a ditch or something, right? And you could say, well, we don't think there's any harm been done, and then you wouldn't have to notify. That's gone. These days, if the data is gone and you can't, regain it, and you can't show that it was thoroughly encrypted or something like that to show that it couldn't have been accessed, then the fact that it's gone is good enough. You have to notify now. Okay. So you don't have to believe necessarily that it's fallen into the hands of the wrong people. So
we have a question here concerning what are some of the most common failures in regards to compliance, or at least control failures that are introducing risk in an environment concerning protected healthcare information. Steve, I'd like to hear your opinion on this, but from my perspective, I would say fundamentally what I see as maybe one of the highest root cause of risk to PHI is, and this extends to almost any type of sensitive data, frankly, is the lack of visibility within the organization as to where all of this data lives. So you could have the most robust security controls in the world around the database that has all the known, that is the primary system of record for your healthcare data, with encryption and robust access control at the database level, the operating system, the network level, across the whole OSI stack here, with all the requisite network security controls. But then what you don't realize is that somebody in customer service thought it would be really convenient if they whipped up a quick access database with copies of that data to make it more accessible to provide services to your customers in the interest of goodwill. And now suddenly you have protected healthcare information. So from my perspective, that's what I see most commonly, is that organizations don't have an accurate inventory of all of the instances of healthcare data or any other sensitive data types that they're trying to protect. Could you? It's a little bit general, but
no, probably the biggest ones I've seen recently, and if any of these people are on the phone, I apologize. But the biggest ones I've seen recently is things like people putting things on file shares, like they're making PDFs of data and leaving it around on file shares, not realizing that means you've got electronic healthcare information just laying around in a semi-public place. Things like they do automated scans of things, and the scans drop it in a directory, and no one ever cleans out that directory, and you've got years worth of people's data being scanned in and just piling up on these file servers. And
that's a good one. The digital copies of hard copy forms really also presents a lot of data sprawl that's not formally managed in many cases.
Yep. So there's a lack of awareness. I think this could probably be described as a training issue, an awareness issue, where people just don't realize that what they're doing is they're leaving data laying around in places that it ought not be. Personal file shares, things like that. The other thing, besides just caches of uncontrolled healthcare data that we see, are people not having any idea who's coming into their environment and what they're looking at. What I've seen is, companies that have electronic protected healthcare information, in a variety of places, in databases, on servers, things like that. And then they've got all kinds of vendors coming in over their network, like remote accessing them, coming in and being able to have access to those machines without anybody controlling it. On one hand, they've got things like their Epic system where, they have a very good auditing model of that. Like Epic records every instance of somebody looking at any individual healthcare record. And so, they do regular reviews of that, and they've got boards that take a look at who's been checking what data. But then they have a big cache of data just sitting on a file server, and they have all kinds of remote access vendors coming in who can access that file share, and nobody knows what they're looking at or what they're doing with that data. Or, even if you've got a database, if you haven't been patching the database, and you've got all kinds of people logging into your environment and able to have full network level access to these systems, those systems can be breached, like at the network level, by someone who's coming in for whatever reason, and people don't keep track of what vendors they're allowing access, who's coming in remotely, what people are doing in their environment while they're there. So these are the things where we're seeing a lot of lack of attention to that. So
we have a few questions here concerning the applicability of HIPAA, and also some concerning ways to transfer the responsibility through outsourcing. So the transfers piece gets back to the question we had concerning how some of the strategies that small businesses could take to mitigate the responsibility.
Yeah.
And so if you're outsourcing handling of any protected healthcare information that you would have, so that your organization no longer has it, instead a third party does, then the HIPAA does not apply to you, because you don't have any HIPAA data that you actually need to implement controls on.
Yeah.
So that is a very valid strategy, of course. There's a little bit confusion about some of these terms as far as covered entities versus business associates. Can you speak to that a little bit?
Yeah. So covered entities are people who provide, medical services, basically. And then I think that also includes, health plans and health clearinghouses and things like that. So, basically, the more, if you're dealing directly with medical services, if you're either a provider of medical services or if you're directly involved in paying for medical services, then you're pretty much a covered entity. Most covered entities here probably know that they're covered entities. I would be a little bit surprised if there were any covered entities here, on the call who were not aware that they were a covered entity. What we probably have is a lot of people who are business associates and subcontractors of covered entities who may or may not be aware, because the problem is that, like I said, historically covered entities have not always been all that great about properly doing business associate agreements. So realistically, what is supposed to happen is that when you do business with a covered entity, they are supposed to execute a contract with you that covers all of your HIPAA obligations. The truth is, a lot of them have gotten nervous about that, though, and even though they still are writing the business associate contracts, and in fact the Health and Human Services website has some suggested language for them that they'll often include. So like you'll get a lot of boilerplate language included in the contract just because they pulled it down from the HHS website. But a lot of covered entities are becoming more nervous about this and not trusting to simply the contract terms to protect them. And this is why they're asking people to become HIPAA compliant. And that's why we're getting people asking us, well, what the heck does that mean? What does being HIPAA compliant mean to me, a business associate or a subcontractor? And this is why basically what it comes down to is when they say we want you to be fully HIPAA compliant, what they mean is that they want you to demonstrate that you can comply with all of the terms of the security rule.
Right. In regards to covered entities and determining whether or not that applies to you, which, to Steve's point, I would agree that most covered entities are well aware of this by virtue of being, a direct, medical provider. But that being said, there is a pretty nice flow chart on the Health and Human Services website that is basically like a decision matrix that asks you questions to determine whether or not it applies. And there's some things that get a little bit more confusing that it helps you address concerning like health plans and, do you have fewer than 50 participants? Is it self-administered? And some of these decision points that would determine whether or not you're a covered entity. So that's a good resource as well. So we're out of time here, though. So
someone asked for a copy of the slide deck. Can we make that available?
Yeah.
Will that be on the website?
As we say here.
Yes, okay.
It'll be on the website. So you could reach out to us directly through the website for any additional information you have concerning HIPAA compliance, its applicability, strategies for mitigating the risk of compromised protected healthcare information, strategies for implementing effective risk management programs, or any other questions that we didn't have time to address in today's webinar. So thank you, everybody, for your time today.
Thank you.